Hi everyone, I'm Dr. Parissis. I work in London, UK, in partnership with Feller and Bloxham Medical in Great Neck, New York. What I'd like to do today is ask you a question. And that question is, which country for the last 5 years has performed the most number of hair transplants in the world? And that last year performed over 1 million hair transplant surgeries, and a total of $2 billion was spent on hair transplant surgeries alone. In this country, hair transplant surgery forms a significant portion of their tourism, dubbed medical tourism. This country relies on hair transplant surgery for a lot of its income. That's right, you probably guessed it, Turkey. Turkey is by far the most visited country for hair transplant surgeries in the world. British patients form a significant portion of the total number of patients going to Turkey for their hair transplant surgery. I have lots of colleagues and friends who have dubbed the term the Turkey treatment. They've said themselves that they've noticed some hair loss and that they're not worried because they're going to go to Turkey and get the so-called Turkey treatment. And there really is no question of getting their hair transplant surgery in the UK. I wanted to discuss some of the pros and cons and some of the things that patients from the UK need to consider before they go to Turkey to get this procedure done. So the obvious reason most patients go to Turkey to get this procedure done is because it's significantly cheaper. The cost per graft in Turkey averages at 83% less than the cost per graft in the UK. There are over 500 hair transplant clinics in Turkey alone, and this brings me to my first point. Having so many clinics to choose from means that there's a significant variation in the quality of these clinics. A lot of them are competing with price, and this drives prices down. There are some clinics offering full package treatments for as little as just over £1,500. And with hair forming a considerable part of someone's appearance, I don't think that anyone would like to take a risk on quality. I know a lot of people that certainly wouldn't take a risk with their hair. They would not risk having a poor result for a slightly cheaper price. So the price of hair transplant surgery in Turkey is by far the most attractive part of going to Turkey for it. But in order for clinics to be charging such low prices, there is no doubt that there is compromise on the quality of the procedures. First of all, to be charging such low prices, doctors are likely performing multiple surgeries a day. They are using technicians to perform the bulk of the surgery, at times to perform the parts of the surgery that a doctor ideally should be performing, the parts of the surgery that require expertise, knowledge and experience, parts of the procedure that a doctor should ideally and really be doing. These parts are not being done by doctors because some clinics are performing multiple procedures at the same time in different operating rooms. The doctor would come in, check on what's happening, and then move to the next operating room where another case is happening. The other thing is that because I know exactly how much a hair transplant surgery overhead costs, it's not a cheap procedure for us doctors. Generally, a hair transplant surgery is going to cost in terms of the equipment that is used, the anesthetic, the personal protective equipment, sterilization of equipment, as well as running costs for the clinic itself. So to be charging such little prices means that some costs have to be cut somewhere. And the question I'd like to ask UK patients is, do you really want to take the risk if clinics are cutting costs with things like equipment and things that might reduce the possibility of you having a successful outcome? The second thing I'd like to outline is aftercare. One of the things we pride ourselves in the UK of having is an excellent aftercare delivery. And now aftercare is very important with any surgery. The surgery is not finished until there is full healing. As with every surgery, hair transplant surgery is no exception to complications down the line. Infection, bleeding and post-operative pain can be some examples. If there are any post-operative complications, the chances of you being able to return to Turkey to be dealt with by the same surgeon is very, very low. And even if there are no post-operative complications, one thing we pride ourselves in the UK of doing is having an in-person follow-up just for good measure. And they might need a top-up on painkillers, and we do want to see how the staples or sutures are healing the wound. The other thing that I observed in Feller and Bloxham Medical in Great Neck, New York, is just how excellent the long-term relationship with the patient is that Dr. Feller and Dr. Bloxham are delivering. Hair transplant statistics from the International Society of Hair Restoration Surgery in 2022 found that people are getting multiple hair transplant surgeries because hair loss is progressive. Hair transplant surgery is shooting at a moving target. Hair loss happens, and then we use hair transplant surgery to mitigate that. But if it does progress, then further surgery may be required. There really is no replacement for having a doctor who knows your case, follows your journey, and tackles hair loss with you in the long term. Different opinions from different surgeons using different approaches can result in patients receiving mixed results as well. So there's no substitute for having a doctor who knows your case, follows your hair loss journey, and stays with you in the long term. As a medical tourist in somewhere like Turkey, it's very unlikely that you're going to even be remembered once you leave the country. As well as these clinics hiring multiple doctors at a time, it's unlikely that even if you were to go to the same clinic, that you're going to be seen by the same surgeon who performed your hair transplant surgery. After doing a lot of research on hair transplant clinics in Turkey, it's clear that most of them are delivering FUE. FUE, or follicular unit extraction, involves individually removing graft from the back and sides of the head and implanting it to the top. But at Parissis Medical and at Feller and Bloxham Medical, we recommend that FUE is only used when FUT has been done, and that no further FUT can be done, or in patients who require a low number of grafts. It includes patients who require less than 2,000 grafts. And so for patients requiring more than 2,000 grafts, FUT is really the best way of getting most of those most androgen-resistant grafts in the center of the safe donor area. Also, using FUT first maximizes the number of grafts over a lifetime that a patient has access to combat hair loss for as long as possible. So anywhere in the world, a telltale sign of a very good hair transplant clinic is a clinic that provides both FUT and FUE. Neither of them are better. They are appropriate in different situations. It also means that if you do need a mega session and you want to go to Turkey, that you have to get that done via FUE. This is going to allow you access to fewer grafts over a lifetime. Also means that the surgeon might have to venture out of the safe donor area into other less safe areas where grafts are not actually permanent, and so therefore you would be transplanting unsafe grafts that could still fall out in the future. There are clinics in Turkey offering mega sessions of up to 5,000, some as close as 7,000 grafts via FUE alone. Now, the chances of patients being able to actually receive 5,000 or 7,000 grafts and having the safe donor area to support so many grafts via FUE without going outside of the safe donor area is very unlikely. The average patient is not going to be able to harvest 5,000 grafts. As proven in my paper, I found that the average patient actually has access to just under 3,000 safe grafts via FUE alone. So in summary, I think the main good things about going to Turkey for your hair transplant surgery is that it is cheaper. And also, there are quite a few clinics that have quite a lot of experience with FUE. And so we would not be totally against patients going to Turkey and getting small FUE procedures done. But in doing so, the patient needs to recognize that there won't be any adequate follow-up. And you will not get that kind of long-term relationship with your doctor that is so valued by many patients already who have undergone hair transplant surgery. As I said, the final thing I do want to stress is the lack of FUT in Turkey. FUT has proven itself to still remain to be the gold standard for hair transplant surgery. And the lack of FUT in Turkey means that patients are receiving mega sessions under FUE and may run into problems in the future with safe donor area. And the proof is in the pudding. I've been to several hair transplant clinics in the UK, and many of them are actually performing hair transplant repair procedures because patients have gone to Turkey and they've received a hair transplant surgery that they're not happy with, and they haven't been able to contact the clinic back in Turkey that they received the procedure from. Alright, thank you very much for listening. I hope this helps any patient based in the UK who wants to get hair transplant surgery. I think there's quite a few things to think about before getting it done in Turkey. Once again, I'm Dr. Parissis from Parissis Medical. If you're in the US and you're thinking about getting hair transplant surgery, submit an inquiry in the link below, fellermedical.com. And if you want to have a consultation with myself, as someone with a lot of expertise in the hair transplant industry, also place an inquiry in fellermedical.com and mention Dr. Parissis. Or if you'd like to get in contact with me directly, you can email me at drparissis@gmail.com.